Hi guys, I'm Becca and I'm a second year student nurse at the University of Nottingham. Welcome back to my channel, and if you've never seen a video of mine, then welcome. This week on my Instagram I asked everybody to send me some questions about nursing and doing nursing at uni, so I'm going to answer those for you today. If you don't follow me on Instagram, I am at Rebecca_BRRTT. You should definitely follow me on there because I post a lot of content. I try to post every couple of days on my stories, and some of it is nursing related and some of it isn't. So please follow me on Instagram. You will get the chance to be able to do Q&As and take part in the polls and things like that. So it would be really great if you could give me a follow on there. I had so many questions, so thank you so much to everybody who sent me questions. I really appreciate you doing that. I couldn't answer them all, and a lot of them were kind of similar, so I've kind of done some generic questions like from what I was sent, and they are in three categories. So I have academic, placement, and then social life aspects of uni and stuff like that. So yeah, let's get into it. The first section is academic, so all of these questions are going to be around the academic side of the degree. The first question is, what year am I in? I start my second year on the 23rd of September. I am officially a second year, but I start my lectures officially on the 23rd, so I have done an entire year of the degree. My second question is, did you do A-levels and what grades did you get? I did do A-levels. I did A-level biology, psychology and geography, and I got an A in psychology, a B in geography and a C in biology. The grades to get onto my course at Nottingham were BBB, and because I got ABC they let me in because it's the same amount of UCAS points. And at Nottingham we actually accept psychology as a science, so because I got higher than a B in at least one of my science subjects, they accepted me. The third question was, how many assignments did I have in my first year? Altogether I had 6 assignments. One of them was formative, which meant it was like a practice, and then 5 of them were summative. I took 3 modules last year: professional values of nursing, communication, and then person-centered nursing care. I had 2 assignments in the first module, one about safeguarding and then one about confidentiality, GDPR, laws and ethics and things like that. In the second module I had the formative one, which was to write a reflection on something that I had done, and then I had 2 more. The second one was about a communication theory and it had to have a creative piece with it, and then the third one was about a group conversation and I did it about community handover. And then in the third module it was about person-centered care, so I had to take a patient from one of my practice areas and I had to write about a nursing assessment that I had done for them and talk about it in 2 different lenses. So I did biological and also lived experience as well. I spoke about the patient and that assessment and what their life was like living with their illness. The fourth and final question of this section is, did you have any exams in your first year and were they as stressful as A-levels? Yes, I did. I had 4 OSCEs and then 1 online multiple choice exam. The OSCEs are the practical exams, and I had hand hygiene, basic life support, first aid and TPR-BP, so that is temperature, pulse rate, respirate and blood pressure. So you have to do all of them manually and then also the automatic ones as well. In the basic life support I had to do CPR, and you can get child or adult, and I got adult. And then in the first aid you can get either a burn, a sprain/fracture or a bleed, and I got a fracture and I had to put an arm in the sling. And then hand hygiene is obviously the 7 steps of hand hygiene and washing your hands. They were definitely not as stressful as my A-levels because it was really nice doing the practical stuff, and because I practiced the practical stuff over and over it just kind of became second nature. And we had lots of help from the university as well. They had lots of drop-in sessions where we could go and practice. And the online exam that I had was really easy. It was the medicine calculation exam. It sounds really daunting, but it's really not, trust me. It's really easy, basic math stuff. So it's like saying if paracetamol comes in 250 milligram pills and the patient needs to take 500 milligrams, how many pills do they need, and then you also can calculate the doses for injections and stuff like that, how much you would draw up in the needle. It's all pretty basic maths, so, and it's all online. I think they gave us an hour to do it, and most people finished it in about 10 minutes, so we were just sat waiting. It was really, really easy and not at all scary, so don't worry about that. The second lot of questions are all about placement. So my first one about placement is, what placements have I had? Last year I was on stroke rehab, interventional radiology, and then I was on the community. And this year I am doing HCOP mental health, and then I'm on orthopedic surgery, and then I am at the ICU. So on stroke rehab, it was patients who had been admitted to hospital following a stroke. They go to the admissions ward first, and then they come up to us for their rehabilitation. And then interventional radiology is any kind of small surgery that needs to be assisted by ultrasound or x-ray. So fistuloplasties and things like that, really, really small stuff, they come to us. And then community was going to people's houses, going to nursing homes and care homes, and running clinics at the GP as well. And then this year I'm going to be on a HCOP mental health, so it's for older patients who are admitted to hospital but also need help by a mental health nurse as well. So they get the physical adult nurses who help them and also the mental health nurses. And then orthopedic surgery, it's a mixed gender ward for post-orthopedic surgery, so hip replacements and things like that. And then the ICU is the one-to-one critical care. The second question in this section is, what kind of shifts did you do on placement? It all depended on what place I was at. When I was on the stroke ward, I did all long days, because when you're on a ward, you normally do long days or nights, and a long day shift is 12.5 hours, 7 o'clock in the morning till 7:30 at night. I didn't do any nights while I was there because that was my choice in my first year, but a night shift is 7 o'clock at night till 7:30 in the morning. You can do short shifts on wards, so that is from 7 until 1 or from 1 until 7:30. But if you do short shifts, you have to do 5 of them in the week. But if you do long days, then you do 3 or 4 a week and then get to have the rest of the week off. When I was in interventional radiology, I did 8 until 6. So I did 4 days a week, and it was Monday to Friday. They didn't open on weekends. So I had every single weekend off and then 1 day during the week. And then community, I did 9 till 5, and mostly that's Monday to Friday as well. But I did work some weekends because they cover the practice nurse patients because they don't work on a weekend. So I did pretty much during the week, and then I did 1 weekend as well. The third and final question in this section is, what was my opinion on my placements last year? So I can't really tell you like lots because I'm like kind of afraid of breaking confidentiality. I don't want to I don't want to break any rules. And if I look down, I've written like some stuff down, so not to like stray off and start rambling. So I'm sorry if I do look down to have a look. But yeah, the first placement I had was the stroke rehab ward, and it was a crazy first placement. I had never worked in care before. I was working part-time as a teaching assistant at a theatre school, and then they just threw me straight onto stroke rehab, and it was a really, really intense first placement. But I ended up learning lots and lots because I just kind of got thrown into the deep end. And when you get thrown into the deep end, you can either sink or swim. And I decided to take it as a learning opportunity and take every single opportunity that I could. I had 2 really amazing mentors, and they were always looking for stuff for me to do or for me to watch. They'd be like, Becca, I'm about to come and do this NG feed. Do you want to come and watch? And then after I'd watched a few times, they let me to start having a go myself. And then by the time that I left, I was actually doing NG feeds every single day by myself, obviously with the supervision of my mentor because it was my first placement. But I actually managed to get my enteral feeding essential skill ticked off, which a lot of people don't get the chance to while they're out on placement. And by the end of the 3rd year, they have to do an exam at school to be able to do it. But I managed to get it ticked off in my first placement, which is absolutely amazing. And I got to work with the physiotherapist for the day as well and see how they work, and that was completely just really awesome, and I loved it. I got to see a patient walk for the first time since he had his stroke, and it was just so heartwarming. It was so, so lovely, and I did really end up enjoying it at the end, but I don't think stroke is an area that I would want to go into myself. It's very, very taxing and very, very overwhelming. So I don't think that's the environment that I would want to be in every single day, but I did enjoy being there for 6 weeks. The second place that I went to was interventional radiology, and I had no idea what interventional radiology was until I went there. I got told to go to the x-ray reception and then someone would meet me there, so I did. I was so excited that I didn't have to wear my uniform because I was in interventional radiology. I was in theatres every single day, so I got to wear my scrubs. It was so lovely. You come in, you take your scrubs from the shelf. They have shelves of green scrubs and blue scrubs, and you can wear whichever colour you want, mix and match, t-shirts, trousers, all of the different sizes, pick the ones you want, put them on, and then at the end of your shift you take them off and put them in a bag and someone else washes them for you. So it was so nice not to have to wash my uniform for the whole entire 4 weeks that I was there, and scrubs are so comfortable, so I loved wearing them all the time and being in theatre. It was my first time ever in a medical theatre. Working at a theatre school and going to a theatre school myself, I'm very used to being in a different kind of theatre, so it was so amazing to be able to go into the interventional radiology theatres. And because it's x-ray and ultrasound assisted surgeries, I had to also wear a lead apron. They are so heavy, and if you're wearing them for a long time, because some procedures can be quite long, it gets really hot. So the AC is always blasting in the theatre, and I really appreciate that because I just really love being cold. If I could have the AC on everywhere all the time, then I definitely would. And it was very interesting to be able to see lots of different things. I got to see like fistuloplasties and PICC lines, and I got to see a lot of biopsies as well. It was very interesting to be able to see things like that, but I'm very happy that I was only there for 4 weeks, because if I was there for any longer, I think I would have been bored out of my mind. I had 2 very lovely mentors again, and they were very good at getting me like involved and helping me to get my head around like what was going on. And I was actually ended up doing a lot of the paperwork because I couldn't really do much while I was in there because I didn't have any experience in theatre at all, but I did end up learning all of the paperwork side and some of the physical stuff as well. I never got to scrub up because I was only there for 4 weeks. If I was there for a little bit longer, I probably would have got the opportunity, but unfortunately I didn't get to. But if I was there for a little bit longer, I probably would have been really bored because there wasn't much I could do, and I did get to see the same things over and over again. While I was at interventional radiology, I got to do 2 insight visits, one to the cardiac cath labs and then one to the haematology day case unit, and I absolutely loved both of them. My day on haematology was the best. I got to work with 2 of the nurses that actually helped give my uncle his chemotherapy, so that was so heartwarming, and I absolutely loved it. I got to see a red blood cell exchange, and it was so cool, and the people down there were really awesome. Haematology is now on my list of things that I might want to specialise in once I qualify, so I absolutely loved that insight visit. It was really useful. I just really loved it. And the third place that I went to last year was the community, and I cannot put into words how much I loved the community. I don't know what it was about the community, but I just loved it so much. It was just something about going into people's homes, and you know, sometimes you could tell you were going to be the only person that person's going to see for a few days, and they really appreciate you coming to their house, because if you were to go to somebody's house to give them care as a community nurse, it's normally because they're housebound, and so they can't get out of the house. They don't really see a lot of people, so it's so heartwarming when you get to go to their house. And there's just something so special about giving care for people in their own homes. And we also got to run some of the GPs in the clinics in the afternoon. I went to leg ulcer clinic a few times, and it was really awesome. While I was there, I also got to spend the day with the diabetes specialist nurse, and I got to go with her to her clinic, and it was really eye-opening. And diabetes is also now on my list of things I might want to specialise in, as is community. I don't know if I want to go into community straight away after I qualify, but it's definitely something that I'm looking at for the future. The third set of questions are all about the social aspect side of uni. So my first question is, can you work part-time, and did you? Certainly with the new nursing degree, I would say 100% you can work part-time. If you want to get a part-time job, then definitely do, because you now don't go on placement until your last 4 weeks in May, so you definitely have lots of time to be able to work. I did work during my first year because I was working as a teaching assistant at a theatre school. I worked on just Saturday mornings, so it worked for me. I managed to keep on going. I was quite lucky with my placements, as the fact that my second and third placements were pretty much just Monday to Friday, so I didn't have to really take any time off. I just missed one day of work while I was on placement, and they were really understanding. But also in your first year, they are normally dead understanding anyway. And if you say, I have a part-time job, I don't really have a lot of money, this is my like one source of income while I'm at uni, they are normally quite good at allowing you to not work that shift so you can go to work. I also work as a student ambassador, as you've seen in a couple of videos before. I work on open days and I do interviews, so if this is something that your university offers, I would definitely get on that, because you can get paid for literally going to uni and talking about your course. If you love nursing as much as I do, then definitely would get onto that. I love talking about nursing. I could talk about it for hours and hours. So being able to work on open days and do interviews and talk about it is absolutely amazing for me, and you get paid quite decently as well. And also for every single shift that you do, you get holiday pay, and at the end of every single month you can claim that holiday pay back. The second question in this section is, how much holiday do you get in the year? My first year I got 2 weeks off at Christmas and 2 weeks off at Easter, and then the summer. This summer we broke up quite early. We broke up in June and don't go back until September 23rd. But this year I get 2 weeks off at Christmas, 2 weeks off at Easter, and then 4 weeks in the summer. For the new nursing degree, this is changing a little bit. I know annual leave is changing. I believe that you get 4 weeks off in April instead of 2 weeks, because it's right before you go off on your first placement, so they give you some time off to be able to get ready to go on your first placement. So I'm not entirely sure actually how many weeks you do get in the first year of the new degree, but I only got 2 weeks at Christmas and 2 weeks at Easter, and I still only get 2 weeks at Christmas and 2 weeks at Easter, and then this summer I get 4 weeks off. So not a lot, unfortunately. We don't get any of the half terms off or anything like that. We're normally on placement during half terms and stuff, but you know, it means that the degree is 3 years and not anything longer, because if we did have normal time off like of the university courses, our degree would be 4 or 5 years long, like a medical degree. We're trying to basically fit all of this placement and all this theory into 3 years, so we don't get a lot of time off. The third question is there a nursing society at the University of Nottingham? Yes, there is. There is the NMA, it's the Nursing and Midwifery Association, and if you do nursing, any branch of nursing or midwifery at the University of Nottingham, I would highly recommend joining. I am a member myself. They do socials, they do alcoholic socials, but also non-alcoholic socials as well. And they have started to bring out like a newsletter, and it's written by students for students. I would definitely join if you have the chance to. Unfortunately, is not a nursing specific one. I believe that there is a midwifery society as well as the NMA, but there isn't a nursing society. There isn't an adult nursing society, mental health or child nursing society. However, if this is something that you wanted, you could go to the university. If you have enough people interested, you can go to the university and then they start up the society for you. And the fourth and final question in this section is, did you join any societies? Yes, I did. I joined the Harry Potter and Quidditch Society, the First Aid Society, and the NMA. I didn't actually end up going to any of the First Aid Society meetings because they met at the same time as the Harry Potter and Quidditch Society. And when I went to the first meeting of Harry Potter and Quidditch, I just knew that I loved it so much and that I wanted to come back every single week. So I didn't want to miss any meetings. I did have to miss some while I was on placement and during exam time, but whenever I could go, I would go. And unfortunately, because First Aid met at the same time as Harry Potter did, that means I couldn't go to any of the First Aid meetings. And then I joined the NMA as well. Like I said before, if you are studying nursing or midwifery, I would highly recommend you joining. It's just nice to have some support of people on your course, people who understand it. Maybe you can go to them and, you know, talk about placement, get some support. They also throw events, so you can meet people on your course, you can meet people from the older years, so it's definitely worth joining. And I would say, especially with this new degree, you're going to have a lot more free time because you're not going on placement until the last 4 weeks. I would join as many societies as you can, because then you get to meet people with the same interests as you. That's why I joined the Harry Potter Society. If anyone knows, I love Disney and I love Harry Potter, So I thought, why not join the Harry Potter Society? I was actually wearing my Hufflepuff jumper at the Freshers Fair, and they saw me, and so they kind of like brought me over and they told me about what they do, and I absolutely love going, and I can't wait to start going back in September. Okay guys, that's it for today's video. Thank you so much for everyone who sent me questions on my Instagram. And again, if you don't follow me on Instagram, follow me at Rebecca_BRRTT so you can get involved in future things. And I'm also on there quite a lot. If you have any other questions, don't be afraid to DM me. I'm always in my DMs, always answering questions. I'm there for advice. If you want anything on Instagram, then hit me up and I am totally cool with that. So if you like this video, give it a thumbs up and subscribe down below and hit the bell icon so you don't miss a single one of my videos. Thank you so much for sharing and for liking the videos, and thank you so much again for some more subscribers that have come since my last video. Really appreciate you subscribing, and I hope that you stick around. So thank you so much. I will see you next week with another video. Bye!